to ensure the quality and safety of these drugs.
The Meghalaya government is fully prepared in case of a surge in COVID-19 cases in the state. Talking to reporters, Health Secretary Ram Kumar said that a total number of 5 cases were reported on Wednesday, adding that they expect to see more COVID-19 cases in the coming days. According to him, the good part is that no one was hospitalized. Health Secretary informed that the existing COVID wards in hospitals will need to be reactivated whenever required to handle the cases. Kumar said that the state government will review the situation before issuing any advisory for the people to follow COVID-19 protocols. The Health Secretary further said that manpower would be ramped up by reappointing people on contract if the situation demands.
So today we have had 5 COVID cases, and tomorrow we are expecting similar number or slightly higher in number. But the most important point is that we need to always have a look into that in terms of our preventive aspect. In terms of preparation, we still have the COVID hospital, which is there. As of now, we don't have any patients, but we have the COVID wards, which were there in many hospitals, can be immediately reactivated wherever this has to be required. So, and we have created a lot of additional isolation centers. We have the 100-bedded facility even in near the Ganesha's hospital, which is in Tura, it has been created. So we have enough facilities in that sense. We should not have any issues.